Does running impact female hormones? Is stretching before and after a walk or run necessary? How much walking should I add to my day? All of that and more on this episode of The Healthiest You. Are you a walker, a runner, or neither? I should probably say that I'm one or the other, but I'll be honest, I'm not. I walk from the studio to the coffee machine. But today we're talking about running, walking, and how they impact your health, not just your physical health, but also your mental health. We're focusing on women's health and wellness on the Healthiest You podcast. Whether you're on your way to work or enjoying a cup of coffee, take this time to focus on your health. Here to talk about walking versus running and how they affect your mind and body are physical therapists Reiss and Neil Shapiro with Lehigh Valley Health Network. Ashley, Neil, thank you so much for joining us and welcome to the show.
Thank you for having us.
Thanks for having us.
I know movement is essential and it's essential for healthy living, but walking or running, is it better for a woman's health?
Yeah, so first and foremost, before you do any form of exercise, it's always important to get a health checkup and get cleared with your physician. Okay. The decision to run or walk will vary based on person to person. And, it's generally not recommended to just get up and start walking. You always want to kind of condition yourself prior to starting any sort of exercise routine. So normally we recommend a walking program first, and then as you start to notice that your strength and your endurance are improving, then you can kind of work into running.
Okay, so I shouldn't just decide like right here and now, I'm going to go for a run. No.
Probably not a good idea.
Okay, all right.
That just predisposes you a little bit more for injuries.
And I'm injury prone as is, so let's move on.
Choose to run, but smartly.
Oh, smartly. That's a great way to present it, Neil. Thank you.
Yeah, so anyone that has a couple more what we call comorbidities, people that tend to have any sort of joint issues, arthritis, people that are in a higher classification of BMI or your body mass index, it's generally recommended to start slow and work your way up.
That makes the most sense. And being in that classification of a higher BMI, I wouldn't start right away.
Oh, you look great.
That's enough out of you, Neil. Now, stretching before and after we've been cleared, we've talked to our primary care physician. Stretching, necessary before, after a walk and or a run?
It is vitally important for both. Before and after. Before, we recommend doing what's called a dynamic warm-up, whereas you're stretching your muscles with controlled motion. So a lot of 3 to 5 basic drills. A lot of people know butt kickers, which is literally you're kicking yourself in the rear end.
Sorry, the visual that went with that. That's fantastic.
Easiest way to explain
You've done this
it.
Okay. Some of the other stretching exercises.
And high knees, where you're lifting your knees up towards your chest.
Okay.
And you're quickly alternating side to side.
Okay.
These just allow the muscles to get primed and get ready for the exercise that you're going to end up doing, as well as providing the muscles with a quick stretch. But on the flip side, also doing a proper cool down is also generally recommended. And that can just be, 5 minutes or so of just leisurely walking, followed by some stretching of the major muscle groups in your legs, just to help improve flexibility, decrease some of that post-exercise soreness that most people tend to experience.
Okay. When you said cool down, I thought just standing over the air conditioner vent to cool down as I had overheated.
Well, sometimes that helps with bringing, the body temperature back down.
So we can incorporate that into our cool down. I love it. My husband's going to love hearing that.
There you go.
How does regularly walking or running for exercise affect the female body specifically? Can it reduce risks for certain cancers, add years to our lives? Because I think that's what everyone's chasing is, can I add years to my life?
Yeah, and so what we know about cardio activity is that it can be really beneficial for your health across all aspects, right? And so not just for women, men too, that by exercising you can reduce your dependency for glucose if you're a type 2 diabetic. It can reduce your blood pressure if you take blood pressure medication, help you with weight loss and other things. But you also want to think about those comorbidities that Ashley was talking about. Okay. Talking about cancer, there is some research out there showing that cardio activity can reduce your risk for developing certain types of cancer, including breast cancer, which, is unfortunately a little prolific in women these days.
Unfortunately.
And then, I have some personal experience with that. So I used to work out in Chicago area. I worked with a group called Recovery on Water. So it was a lot of women that were post-diagnoses. And there's a woman that I had met who was training with this rowing team. She also ran and biked, but she had gotten kind of a bad life expectancy, and she was 15 years out from it. And so she put it all on healthy eating and exercise. So I would say not talking about just running, just general exercise and activity.
Including that into a healthier lifestyle.
Yeah.
Wow. That's a wonderful story, Neil. Thank you for sharing that.
Yeah, no problem. I love it. So I try sharing it as much as I can.
It is a great story. And I think more and more people need to hear that it's not a diagnosis is not a death sentence.
Correct.
That there's so many things that we can incorporate into our lifestyles that can, like you said, increase longevity. Now, since running is more strenuous on the body, how would it impact female hormones?
So our hormones are regulated by our organs and then by specialty centers in our brain. And they're normally released in response to stresses on our body. So some of the more well-known hormones are your endorphins. Those are endorphin release. So after running for a period of time, some people experience what's called the runner's high, where you have a state of feeling very relaxed and calm as you're exercising. And that's just due to an endorphin release.
That makes a lot of sense. I think I need to start running because I've never felt that.
I've only felt it once or twice.
Okay.
Adrenaline is another common hormone that's released and also in response to exercise. So when somebody's striving to reach a PR or get to that finish line, that burst of energy at the end of your workout or your run when you're feeling really gassed is due to adrenaline just to get you over that line.
Okay.
The other hormone that most people have heard of is cortisol. So that's our stress hormone. Cortisol, too much of it in our system can actually be negative. So if you're overtraining, having built up levels of cortisol in your system can actually kind of put you into what's called a fight or flight response. So for women in particular, this can end up having an impact on your menstruation, on your reproductive system, because your body is diverting energy that is being sent to those body systems to the systems that they need for survival. It's just your body's natural protection mechanism.
That makes a lot of sense.
So women that are overtraining or overexercising, it can actually sometimes affect those body systems. And that's actually one component of what's called the female athlete triad. 3 components, one being menstrual health. So in women that are overtraining or overexercising, they start to see changes in their menses.
Okay.
Another component is decreased bone mineral density, and that kind of goes along with your menstrual cycle dysfunction. And the third is just poor energy availability. And we screen for those with our athletes because they're vitally important. And a lot of times they take what's called a multidisciplinary approach to treating fully. Mm-hmm. So that's part of our screening process with any female athlete. So that way we can get them the treatment that they need if they start to show any signs of that triad.
Okay.
Yeah.
If I was an athlete, I'd be going, Ashley, you're, and not to
no
offense, Neil, but if I was to be an athlete, Ashley, I think Ashley and I would be great friends. Neil, did you have something to add?
Yeah, I was going to say that, I feel like when I treat my female runners, it's so common, especially female athletes at a high level, they have such an expectation that weird menstrual cycles are normal, right? Oh, everyone has it, so this is a normal
because
thing.
everyone has it doesn't make it normal or healthy.
Yeah, and so I've been trying to educate more and more hey, just because you don't have it or it's irregular or it started really late and everyone else does that, that's not a normal thing for you and it can have these big kind of issues down the line.
That's great. Wow.
So balancing the hormones while running helps with balancing. On the flip side, doing too much of it can actually be a negative thing. So moral of the story is balance is key. So finding out where we are in our balance to help regulate our body systems is
that healthy medium.
Yeah.
Yeah, that healthy medium is really,
sometimes
really
that can
important.
Be a little hard to find. So sometimes you also need some help from other providers to be able to get you to that point.
I think balance in any aspect of our lives is difficult to achieve, and we're always trying to find that balance. For example, how much water I should and should not be drinking because now I need to pee again. And not only is it in the script, but I do have to pee. and it's a pretty regular thing. And yes, I'll admit to it that I do drink a lot of water and then I have to go to the bathroom. That is probably a thing that a lot of runners have to consider. I always wonder during a marathon or any in that situation, how do you handle that? Do we strengthen the pelvic floor? Is there something we should be doing?
Mm-hmm. Well, so for your marathon question, there's always bathrooms along the way. So it's good to go to the bathroom and not hold it, right?
You sound like a parent. We should go when we see the bathroom. Okay.
But yeah, in general, so urinary incontinence is a very common thing with women, especially usually postpartum. So things just get a little bit weaker. But pelvic health isn't something that's just women only, right? Any runner, any athlete. So
wait a minute. Men have a pelvic floor.
Men have a pelvic floor. Whoa.
Color me. Exactly. Mind blown.
Yeah, so, I would say if you do have any issues with pelvic health, I'm going to put a little plug in, right? PTs can help manage that, right? There is some pelvic health PT in the network and other providers, something you can talk to your doc about.
Okay.
But yeah, I was reading an article, something like up to 40% of women have some level of incontinence.
Oh, yes.
And like 7 to 10% can have severe incontinence, which I don't treat that. I had no idea. So
you're like, that's
wow.
not my area of expertise.
Yeah,
okay.
yeah. I try to treat everything outside the body. Anything more internally, I kind of leave to the experts.
I would tend to agree with that.
Yeah.
I really would, and I can understand a lot of the fight or flight. Are we going to beat the buzzer kind of thing? So that's obviously something that you want to talk about with your physical therapist or with any other of your physicians.
Yeah.
Now, how does running improve bone health? I know that was a very drastic change, but continuing on with running or walking, because that's what this podcast is about, how does it help and impact our bone health?
So there's something called Wolff's Law. It's the idea that your naturally healthy bone will adapt and change over time to the stresses that are put through it. So naturally with running and walking, your weight-bearing bones in the legs and the pelvis and the spine are naturally going to be stronger than those same bones in someone who is not as active. Conversely, though, too much running and part of that female athlete triad that we just spoke about, that can have negative impacts on your bone health. So again, balance is key.
Balance is key.
So, cross-training is important and generally often recommended as a form of exercise and adjunct to what you're already doing. Muscles connect to bone through tendons. So when muscle contracts and the tendon pulls on the bone, that stimulates bone growth and bone rejuvenation.
You guys are so smart. It's so different than radio. We don't know any of this stuff. Please continue. I'm sorry for interrupting.
No, you're good. But again, touching on that female athlete triad, what we screen for in the clinic is any female athlete that has any sort of signs of bone stress injuries or repetitive bony stress injuries or stress fractures. Those are kind of the first clinical signs that we'll see of somebody we need to get this addressed.
Now, we touched upon bone health, and it makes me think, whether your bone health is strong or not strong, who should avoid running?
So that's a tough question for me. I don't know if you've ever read the book Born to Run, Chris McDougall, or there's a guy, Dan Lieberman. He's a researcher out of Harvard.
If you ever see me running, Neil, you should probably run too, because that means that something's chasing me.
Yeah.
Please continue.
So, they're big things. Dan Lieberman, we kind of evolved to be nomads and walk and run. So I think for the most part, all of us have the potential to do it. It's just, is it appropriate for you? And so for the most part, I tell people if you're going to pick up a running routine or really anything new, it's always good to talk to your doc about it, right? We kind of talked comorbidities earlier. So if there's anything like that going on, you just want to make sure that it's safe. And there are certain things that are like really hard stops, right? So if you have like unstable chest pain, really significant cardiac issues, other things kind of going on with like uncontrolled things in your body, right?
Okay.
Good to avoid it. So again, good to talk to your doc. And then there's kind of these relative contraindications, recent surgeries, recent fractures, other things going on.
Some common sense.
Yeah. And so if you go on like Mayo Clinic or Cincinnati Children's or something, they have these nice lists of, if you have this, you shouldn't do this. If you have that, maybe think about it.
It's like a ride at Dorney Park. If you have this, you should not take this ride.
Yeah.
Okay. Makes a lot of sense.
Yeah. And so there are those with running. But again, for the most part, if you don't, I think everyone has the potential to, as long as you progress to it appropriately.
That makes a lot of sense. Now, what about power walking? Is that different? Obviously, it's different than running because it's not called running. It's called power walking. Why might this be a better option?
So walking is a great form of exercise, as is running. Walking is much more less impact than running. So running is around, they say in the literature, about 3 to 5 times your body weight per step when you're running. Walking is obviously not so much.
I think my knees would break. I'm sorry. Please continue.
So power walking is defined as walking at the upper end of your usual casual pace.
Okay.
So if we put this to the scale of a treadmill, the treadmill normal walking pace is around a 3.0. Okay, power walking is more around a 4 to a 5.5.
Oh.
And it still increases your heart rate. It still allows you to burn calories, but at a much less of an impact. So some people that Neil just touched on that fit within those categories, power walking may be a great alternative just due to the low impact nature of it.
Walking, running, how does it improve physical, and as I mentioned earlier, mental health? I see memes all the time that says, oh, I'm out here taking my stupid mental health walk. But I do the same thing because the exposure to the sun and the air and just getting out, it really does help with mental health. How does that affect? More deeper. You guys are more deep than a meme. A little more educated.
Yeah, so walking and any form of exercise in general is great for both physical and mental health. So back to those endorphins, those feel-good hormones.
We love those endorphins.
And that helps improve your mood. It can help decrease stress. It can help, lessen the effects, I should say, of depression and anxiety. There's one study out there that even shows that it helps with learning and helps with memory. So it can improve your cardiovascular health, your whole body health, and as well as your mental health in terms of just boosting your mood and making you feel better.
And I can attest to that as someone that does deal with anxiety and depression. When I do convince myself to go take that stupid mental health walk, I feel considerably better when I come back inside. So it makes a lot of sense. Now, what footwear should we be wearing? My flip-flops, I have a feeling you're going to say I should not be wearing my flip-flops or my Uggs or anything like that.
Yeah, so it really depends on the activity that you're doing, right? Like if you're walking on the beach, flip-flops are not a bad thing for you.
What about barefoot? If you're on the beach, wouldn't you be barefoot?
Yeah, that's true. If the sand's really hot, though, I don't want to burn your feet.
Good point. Thinking ahead, Neil.
Yeah.
Okay, so flip-flops
Always
on the
a
beach.
thinker.
You are a thinker. Okay. Otherwise, what would you recommend?
So otherwise, right, so here's kind of like the dirty secret in the running world is that since the advent of the running shoe back in the 70s to now, there's really been no change in kind of running-related musculoskeletal injury, right? And so you would think you got all these awesome shoes out there, right? And there's been no general reduction in the amount of injuries that you're seeing. Now, the big thing could be like that first Boston Marathon was like less than 100 people. Boston Marathon now is 35,000 people, right? So there's just a lot more people running.
Oh, yeah.
So it could be because of that, you're seeing this higher volume of injury. But kind of going back to the shoe wear, I think it's the people get stuck in their head that the shoe kind of makes you, right? I'm going to get this shoe and it's going to fix everything. And
wait a minute. You're telling me that my new sneakers aren't going to make me run faster?
Well, that's actually not true, right? So there's some research coming out now with like the Nike Infinity runs, the ones that Eliud Kipchoge did the sub 2 hour. Those actually will make you faster. And they're getting banned in a lot of races, that super hyper shoe.
Almost like an unfair advantage?
Yeah.
That if someone is wearing those shoes versus a different pair?
Yep.
Oh.
Yeah.
See, I was just referring to my son. He has new shoes and they're going to make him run faster.
Yeah. And everyone thinks that, and unfortunately, that's generally not the case, right?
Neil.
So what I tell my
I'm going to
patients-
have you call my son and you can go ahead and tell him that.
Fair enough.
Okay.
But yeah, what I tell my patients is usually the best shoe is the best shoe for you. So you go in, you want to find a shoe that works well for you. There's not kind of one size that fits all.
Okay.
That's why I love the local running stores. You can go in, a lot of places will check you out, try things on you, do analyses, fit you for orthotics, right? And get something that works well for your foot. There are big trends in shoes, right? There was the minimalist and the 5 fingers movement. There's the maximalist kind of Hoka shoe. And now we're seeing that hyper shoe, right? With the carbon foot plates and all sorts of crazy technology. People with way more knowledge than me put stuff into these shoes.
Footwear technology is ever evolving. There's new things coming out every so many years, and sometimes it's hard to keep track of. So a lot of times we refer them to the experts, the people at the sports shops, because that's what they do all day.
That's what they do all day. But that's mind blowing to me, and I think it's because I'm coming at shoes from a much different perspective.
Oh yeah.
Versus I'm looking for what's on sale and what's going to look great with my leggings, not what's going to be the best.
I mean,
it should be what's good for my foot, though.
Yeah, so are most runners, right? No one wants to buy that $150 shoe if they don't have to, but sometimes that's better than buying the $20 clearance rack shoe that maybe isn't the best fit for you.
You're right, Neil.
Yeah, or it looks great with my outfit, but maybe it's not the most comfortable.
You're right, Neil. So our shoes, we should really make them more of an investment.
Yeah, and replacing them consistently and using the appropriate shoe for the appropriate activity, right? So a trail shoe on the trail, a road shoe on the road, right? And vice versa.
So you're telling me that I should be going out and buying more shoes for specific situations?
Yeah.
I don't think that's what you were saying, but I'm using any excuse that I can to go shopping.
Yeah, and like the one thing I tend to push people away from too is like when you go to the expo, don't buy a new pair of shoes and go run in those shoes the next day, right? There's a kind of a breaking in.
You have to wear them around the house. We know that with any other type of shoe, you got to break it in.
Yeah, and gradually building your running into it or your walking. And, So
now there's a word here, and I'm not 100% sure, but I think I know what it means. Measuring your stride length. Is that basically your leg, the stride that you take? So my husband takes shorter strides and I take longer strides, but he still ends up walking faster than I do. How do we measure that stride length?
So your stride length is from when your when you're pushing off of one foot to when the next foot hits in front.
You know, I'm trying to do it underneath the table.
Yes.
Okay. All right. Okay.
If you can see that in your head.
I do like the finger walk. So.
Yeah.
I'm having a real, show me the finger walk. That
There
makes
you
sense.
go.
Okay. I'm a visual learner.
So your stride is always going to vary based on the terrain and where you're running. So going uphill or negotiating an incline, you're going to have a much shorter of a stride versus on a flat road, it's going to be more neutral. Going downhill is going to be much longer.
Okay.
So a more accurate measure would actually be called your cadence. And your cadence is your steps per minute. There's no, ironclad number in terms of what you want to achieve when you're running, but generally around the range of 170 to 180 steps per minute. So that's 85 to 90 steps per foot is generally recommended because that's what's been found in the literature to promote the best mechanics.
That was going to be my next question. Why is it important to know these numbers?
And this goes back to, and Neil is a wizard with this one. This goes back just to all the work that one of the guys that he follows, of going out there and actually counting steps of runners just to start to get an idea of where we want to aim.
That's a job.
Yeah. So the way it started was there was like this really famous coach back in like the 70s. His name was Jack Daniels, not affiliated with the
not the liquor.
unfortunately.
I had my hopes up for a second. Okay, please.
But yeah, he went out and he counted cadence for all these elite level runners, and it might have been like the Prefontaine Classic or something. And he found that most of them were around 180 steps per minute, right? And that's usually for like your mid-distance runners. Your sprinters are going to be a little higher, closer to 200. Anything kind of below that's a little subpar. And so kind of like Ashley was saying, there's no magic number, but usually if someone's low, I'll bump them up. If someone's high, I try to pull them back.
Pull them back for that balance that Ashley keeps talking about.
Yeah.
It's all making sense. We're making connections. I get it. So ankles, a lot of times I do have a sore ankle, or wrist weights and things like that. Would it be good to actually incorporate those into your walks or your runs to put weights on?
So maybe not, right?
Okay.
So like you're adding something to the end of your legs that you typically wouldn't use. So you're putting a little more stress on joints. So think of someone that has like some shoulder pain or hip pain or, knee OA or ankle issues, adding that little extra load on that lever probably isn't the best thing for you. Now, if you're going for a walk carrying your hand weights, right, not the worst thing in the world, give you a little extra cardio exertion.
All right.
Maybe doing things, if you do want to add resistance, changing up the terrain, going out and walking on a trail, going up and walking down a hill. Those things are going to get you working a little harder without you having to add anything to it. And it's going to save you some money. Maybe you just have to spend a little more on gas to get there.
And maybe even mental health too, a change of scenery, checking out something different and just incorporating all of the things that you've recommended. Now, I know that there are also weight vests if people aren't doing the ankles or the wrists. What is a weight vest?
So those are very popular with our tactical and our CrossFit athletes.
All right.
So it's a mean of adding weight to your program, but you wear it on your body and a lot
Like your
closer to
core.
your midline.
All right.
It's great for increasing your workout intensity. So someone who's doing more explosive type motions or movements and workouts, it's going to be great for them. But at the same time, it can also be a little bit more negative in that you don't use it correctly, you're going to hurt yourself. You do too much weight, you potentially are going to create some imbalances, postural imbalances, muscle imbalances, which are going to predispose you to injury.
Again, back to the balance. Finding that balance. Are there more calories that you would burn more calories if you were wearing a vest
You
like
would.
that?
The more intense your exercise will be, then the more calories you'll burn. So if you're looking for the weight loss aspect of it, it would be good, but we generally recommend starting at a lower weight and then progressively building up from there.
That makes sense. I keep saying that makes sense, but it does. That's just the first thing that comes to mind. Now, how can I avoid a treadmill accident? I'm sorry, I shouldn't laugh, and it's not comical because they do happen. But I myself have had a treadmill accident, and it's simply just my own flakiness. But how could someone avoid that?
So when COVID hit, a lot of the gyms and fitness centers closed. So treadmill sales went and skyrocketed.
Oh, I'm sure they did.
So that year alone, there were 22,000 treadmill accidents that reported to the ER.
Those are just the ones that were reported. Wow. Okay.
So something as simple as walking on the treadmill or running on the treadmill, you wouldn't really necessarily equate to being a high-risk injury kind of activity, but a lot of it comes down to not utilizing the safety checks on the equipment. So to avoid injury, to avoid damage to your equipment, it's also important to use their safety features. So using their safety strap, so that way if it disconnects, that belt stops.
That's what I do it. I clip it somewhere whenever I'm doing it.
Yeah,
Yes.
wearing it on your wrist, clipping it to clothing.
Yeah.
So that if something were to happen or you had to step off and that disengages, then obviously
it stops. Right.
Making sure that children, pets, anything that can get pulled under the belt are out of the way. Mm-hmm. A lot of these injuries, unfortunately, are happening with children because they're seeing something move. They're going to explore, and then
they're putting toys on it like my children would do. Mm-hmm. Yes, I understand.
So minimizing distractions is also important. Get off of your cell phone. Don't try and read while you're walking on the treadmill. I mean, that always made me sick. But
I always liked watching. My husband installed a television, and we could watch Netflix. And I'd set it for a 30-minute show, and
I'm
that would be
The Walking Dead right now.
I did that as well. I would watch that as well.
Yeah. So we would recommend starting that prior to starting walking on your treadmill.
Starting the show and then getting on the treadmill. Okay.
And then even when it comes to the moving belt, you want to make sure that you're not straddling the machine, start the belt up, and then jump onto it.
That doesn't sound safe.
Mm-hmm. No, but you see it a lot in the gyms. You see it. I see it oftentimes in our clinic. So you always want to start on the belt itself and then gradually ramp up that speed. Be careful with that speed because that speed can get away from you at times.
Oh, it can.
So each treadmill is a little bit different in how it responds to speed. So you hit that speed up button several times, getting up.
Slow down, sister.
Right, slow it down a little bit. Work yourself into it, just so that you don't lose your footing.
No one's recording you. It's not a competition. Just take your time. Now, what is the 12-3-30 treadmill workout thing?
Yeah, so that was a viral thing apparently.
Yeah, that's why I'm bringing it up because it was viral.
So it's funny. I'm in my mid-30s, but I'm an old man. I didn't really hear about it until more recently.
I don't want to hear anything about that. Moving forward.
So basically what it is you're setting the incline on your treadmill to 12%. You're setting the speed to 3 miles an hour and you're walking for 30 minutes.
That sounds like torture.
Yeah, and obviously this super fit Instagram YouTuber, whomever made the video, posted it, and everyone's like, oh man, that looks great. You look good.
And it sounds terrible.
Yeah, and so, it's something that if you're already fit and you're doing stuff, not a bad thing to kind of throw into your routine.
But not
like
for a beginner.
Definitely not, right?
Okay.
And so any of these trendy things you don't want to jump on if you're not used to doing the workout. It's a great way to get hurt. Good for our revenue, not great for just general health, business. Right? So maybe I should say that.
I was going to say, maybe you should or you shouldn't. It's a fine line that we're walking with that one. What are some of the precautions that we should keep in mind if we are not going to use the treadmill, but we're going to decide to run or walk outside?
Yeah, and so,
dog poop.
Definitely dog poop.
Yep,
right?
That's a big one.
Yeah, but I'm thinking more of that like safety component, right?
Oh, I was thinking about my new walking shoes, and I didn't want to get them dirty.
You just spent all that money on them.
I did,
so,
exactly.
Yeah.
Neil, please continue.
Well, yeah. So, one of the things everyone loves to run with headphones in, right? So I'm going to give Aftershocks a plug right now. They're those bone conduction headphones. So
bone conduction headphones.
Yeah. So they don't go in your ear.
They don't go in the ear. They stay like right on top of what's called your zygomatic arch. But that's PT talk.
You are using big words, Ashley. I'm in radio. You got to dumb it down a little bit.
So it goes literally just right outside your ear.
Oh, the thingy that hooks around.
So it doesn't actually go in. It just sits right on top, right? And it vibrates the bone on the outside. And they're pretty amazing. You can barely hear anything from the outside. But when you're listening, perfect sound quality. You've got awesome ability to hear everything around you. So if you're going to use headphones, and I use them myself, I would recommend something like that. Or one earphone in, one earphone out, right?
So that you can hear what's happening around you.
Yeah, and I'd also say, like, when I go running, my wife loves this. I have my Google Maps set up, so my location is always shared, right? So if I'm going for a run, I let her know how long I'm going for. And then if if I'm not back by a certain time, hey, where are you?
Where are you? Do you ever try to draw funny shapes on the maps with your runs?
I used to do Strava art. Yeah.
Those are always comical. Those would go viral.
Oh, definitely. But yeah, and it's also thinking about where you're running, right? So if you're going in a really busy area with cars, making sure that you're paying attention to traffic. If you're going out in the middle of nowhere, making sure that someone knows where you are.
Yes, your location services should be on.
Oh, you got it.
Okay,
yeah.
All right.
Even run with a friend.
A buddy, a running buddy. I did that for a while.
Misery loves company.
don't think that's the best way to position it, Neil, but I'm not gonna argue with you. Exercising while you work. They said it sounds good to me. I'm not quite sure that that's a correct statement, but while you work, walking pads, desk treadmills. So while I'm sitting at the microphone, I could be doing something.
Mm-hmm.
Please tell me more.
So that's gotten really trendy recently, those big walking pads. So the treadmills of 2020, the walking pads of 2023. Seeing it everywhere and everyone's getting one, or a walking desk or something. And yeah, so, Time Magazine like 10, 12 years ago put this article that said sitting is the new smoking, right? And so
it's dangerous.
Yeah. And, you find all these things where if you sit too much, it can increase things like visceral fat, your general circumference around your belly, right? And those kinds of things have been linked to reduced life expectancy. So from that end of things, I would say if you can get up and get moving, great.
I say we're finished right now and let's go get moving.
Yeah. Why don't we take this on the road?
Let's go take a walk. Okay. I'm sorry.
That's all right. But yeah, so what I'd say is if you can, it's always good to take a break and just get out of the building, right? But if you have to, you got a lot of meetings and things, pop on the walking pad and go for a walk. Just think about other things going on, right? So
how does a walking pad work?
Some of them are just treadmills that kind of go under your desk. Some of them are treadmills that have a desk attached to it, which are pretty fancy.
Oh, wow. That is fancy.
Yeah, and they're getting less and less expensive, which is kind of cool.
All right.
But, you want to think about other things that are going on with you. So if you have a history of like concussions or vestibular issues or balance issues, right? I wouldn't recommend jumping on this and falling off and having one of those treadmill accidents we were just talking about.
I happen to have fall risk written at the top of my, so that wouldn't necessarily be for me. That's okay.
Those under desk, walking pads and treadmills, they don't come with the handrails attached to them. So there's nothing really to hold on to, which you want to make sure you have good balance.
Oh, yeah. I would definitely need some sort of guardrails set up for me.
Yeah,
okay.
Yeah.
Well, that makes a lot of sense. And I keep saying that, but it really does. Now, walking pads, desk treadmills, would you say worth it or not worth it?
I mean, if you have the money and you want it, I'd say worth it if you're very busy, but I'd rather you get outside and go for a walk rather than keep walking indoors if you can. You get that little vitamin D too, that extra benefit.
Absolutely. Those mental and the mental health.
The mental health.
That goes along with it.
Scenery. Yeah, just wear sunscreen.
So whether you're using a walking pad, treadmill, how does walking throughout the day benefit us? What are the benefits of doing that?
So it is recommended that we have at least 30 minutes of walking every day.
I thought it was 20.
So we upped it a little bit.
Okay.
That's what's going to give you your most cardiovascular health benefits and help with that heart health. So like Neil was talking about, getting outside and moving around, it's great. But when you're in the busy office setting, you don't have a lot of free time. Taking what we call micro breaks throughout your day.
Like 15 minutes here, 15 minutes there?
Got it.
Is it a cumulative 30?
Cumulative 30 minutes.
Oh, so breaking it up, a little 5 minutes here, a little 5 minutes there, a 10 here?
Perfect.
Okay.
Perfect example.
Thank you.
So I'll tell my patients, set an alarm in your phone or a timer on your phone that every so often when it goes off, get up, take a lap around the office. Even if it's just that short break, just to give a little movement. So the famous phrase in PT is motion is lotion. So moving around is going to help with joint lubrication, keeping your joints going, keeping your muscles flexible and pliable, so that way you decrease some of the stiffness that you get after being in one position.
When you stand up and you have to do the stretch because you've been sitting on calls for multiple hours. I used to have a little tracker that would buzz when I didn't move enough, and it would be like, hey, how about you get up and you take a walk?
Mm-hmm.
And that was helpful.
Mm-hmm.
So I think it's the same thing as setting an alarm on your phone to remind you, hey, why don't you go take a walk?
Yeah, and a lot of the smart devices now give you like standing points. So every hour that you're standing, you get a little, I don't know, mine doesn't do that, but.
Oh, I was going to say, does it mean gift cards or chocolate or any? I work for rewards. This is
yeah.
Well, some of them even have like the 10,000 steps buzzer that it'll buzz off and it'll shoot like bright little flashes on your watch.
Mine used to have that too.
Sometimes that can be enough. Like, good job, you met your goal.
Okay, 10,000 steps is a lot, but you're right. It's good.
It's cumulative throughout the day.
I like how you tack that on. It's cumulative. Now, why, after I'm doing my steps, why would my legs hurt after a walk or after a run?
Yes, I mean, it could be all sorts of things, right? So soreness after exercise is very normal, right? We work out, we use our muscles, things get sore. So you think the kind of the normal things that happen after you exercise. If you're walking longer than normal, you're going to feel it. Think about that DOMS, delayed onset muscle soreness, 48 to 72 hours after exercise. Very typical to feel a little bit of sore. It's when things last longer, you should start worrying about it, right? That 5 to 7 days or more, you start noticing those signs of inflammation, right? I'm going to throw my Latin out here. Your calor, rubor, tumor, dolor, so pain, swelling, redness.
I was just going to say ibuprofen.
Yeah. And that's what most people do, right? Is they kind of manage it. And then now it's a month that it's been going on, and then they're coming in. So usually 7 to 10 days, if something's going on, I would go in, or if it's really affecting your function. So if you can't walk, can't sit, can't stand, talk to your doc. And I'm going to plug LVHN again, right? That nice My LVHN app. Send a message to your doc, got a question, boom, easy.
That's why we're here.
Yeah, and you're getting an answer from someone you trust.
Absolutely. Yeah. I'm getting answers from you guys, and I trust you already. It's wonderful. So we've done a walk, we've done a run. What are the most important things to do afterwards?
So just like we're supposed to have a proper warm-up prior to exercise, prior to our walk or our run, it's also vitally important to do a proper cool down. And like I briefly said before, just 5 minutes of just leisurely walking followed by static stretching of the muscle groups in your legs. So a lot of people know how, you stretch your hamstrings, you stretch your quads, your calves, and you hold those stretches for anywhere to 20 to 30 seconds and repeat them about 3 times for each one. It's also important to rehydrate. So our body loses fluid through sweat with exercise, and we need to replace that. It will help in promoting recovery, help with, promoting muscle recovery after a workout. And water, those electrolyte replacement drinks, those are great options to do.
You must have been reading my mind. That was going to be my next question, Ashley. Thank you. Where we are.
Or even doing a post-workout shake that some of the big nutrition companies sell. Those are all shown to help replenish the stores that we've lost from our sweating as our natural body's way of cooling itself.
What about chocolate milk?
Yeah.
I heard that was the thing.
Yeah. So I was just going to try and say that
it beats you to it. Yeah.
So something like half hour after exercise, your body's most receptive to the proteins and things you're putting back into it to help recover. And chocolate milk is a great one. I ask people all the time. I just went to a course asking nutritionists, if you don't have any lactose issues, chug that milk. So
that's great. What about a chocolate milkshake? Does that count too?
You might be outweighing.
You're going to tell me no. You're going to tell me no, aren't you?
At that point,
all those calories you just burned, you might be adding back in.
Yeah. Well, I could just make it up the next day, right?
Yeah.
Okay. Now, how do I know the difference between just typical soreness and, like you said, a possible injury? Is it if it lasts longer than 7 to 10 days?
Yeah, and that's kind of what I tell people, right, in the clinic, at least if I'm giving them a program, if it's lasting more than a certain amount of time. So if you go online, you can look up something called the Delaware Soreness Rules, and I give that out to a lot of my athletes when they're going back to activity, and it's kind of a nice way of, if you feel this, then you should do this. And it's, back off, go backward, keep progressing.
Okay.
Not something that's going to 100% cover you, but it's just a nice little tips and tricks that I give my patients.
That's a great idea.
And this goes back to also that motion is lotion. So a lot of times when people have that post-exercise soreness and they don't want to go and do anything because it hurts.
That's one of the best things to do is to move it.
Keep moving.
Okay.
Just gentle stretching, gentle motion will help with aiding some of that muscle recovery.
Yeah. And personally, I found, so I do a lot of running. And so after I'll do a long run, I'll hop on the bike and no resistance, just spin my legs for a while. And man, it feels so much better. And you see the guys on the Tour de France finish a race and they just rode for 4 hours and they're riding the trainer for another 30, 40 minutes because it makes such a big difference in that tissue recovery. So you're not just stopping and letting everything just freeze on you.
Oh.
Yeah. Your muscles are kind of pumping that lactic acid out. And that's what gives you that
soreness.
And
that's what gives the soreness. Mm-hmm. Okay, I remember reading about that somewhere.
Mm-hmm. There's also foam rollers now, massage sticks, massage balls that you can use.
You said massage?
Mm-hmm.
Self-massage.
Oh, Ashley.
You could go to a massage therapist if you really wanted to.
Yeah.
But these things you can purchase online or at any sports store and kind of use those to help knead out any sort of muscle knots that you get.
Okay. So if it's not soreness, typical soreness that you might experience after a walk or a run, what are common injuries that you see, and what are some of the things that people can do at home, possibly to treat those, or just come see you at LVHN in the physical therapy?
Mm-hmm.
Mm-hmm.
Uh-huh.
So a lot of the more common injuries that we see have the general terminology of, like runner's knee.
Okay.
which is called patellofemoral pain syndrome. There's also stress fractures, IT band issues, and shin splints, which is medial tibial stress syndrome. These are overuse injuries. These are overload injuries. So it's important. Yes, could you treat them at home? Probably, but not as effectively as if you would come in and get an evaluation with a therapist. Depending on the severity, some of these injuries might actually require us to kind of shut you down for a little bit, where you put a stop on your training and really focus in on the healing. Sometimes they can be managed with just activity modification in combination with specific exercises that your therapist would prescribe to you.
Okay.
And then, newer technology that we have now actually allows us to video you when you run. It's called video gain analysis. It's actually very intriguing. And it allows us to kind of freeze you in a moment in time, really analyze, joint measurement angles. How are you landing? What do you look like? So that way we can adequately address those deficits so that way you don't get injured again.
We're living in the future.
Fascinating. It just makes me think of Running Man and Arnold Schwarzenegger and Terminator kind of stuff. But I digress.
Yeah. I would add on to that, right, that most running injuries, right, are usually due to error, right? Mm-hmm. So it's something like too much, too fast, too soon, too long. And so at least on the running side of things, I can't speak for the walking, that if you're just training too much, and you got to think stress is stress is stress. So life stress can play a big part in how your body feels. So if you're already run down and burnt out and you're trying to do all this mileage, right, you're kind of setting yourself up for something to fail.
It just sounds painful.
Yeah.
Being stressed and then pushing yourself too much, you're just stressing your body.
Well, and sometimes, right, you look at it as stress relief. I'm going to go for my run, but you're already worn down, right? And now you're adding something.
Adding onto it so you increase the chances of an injury.
Yeah. So I'm not saying don't use it as a stress reliever, but just kind of be cognizant that other things can have an effect on your running that aren't just running.
Ashley, what's the word?
Find that balance.
Ding, ding, ding. Now, should we be striving for 10,000 steps a day? I know we touched on this earlier. Is that something that you want to start right out of the gate, or would you be building up to the 10,000? Is that the ideal mileage that my feet should be traveling a day?
Yeah, and so I think, the idea is everyone's different. So, some people, a couple thousand steps a day is great, right? That's what you're getting. And some people, my mother-in-law gets 18,000 steps a day every day. And
what
if
does
she does it,
do?
Lots of walking.
Obviously.
Lots and lots of walking.
Good for her.
But it's really building up to it, right? And so if you have stuff going on, like if you have issues with your feet, if you have issues with your legs, your back, doing a lot of walking may not be so good at a certain point, right? So walking 3,000 steps might feel great. Walking 7,000 steps might feel terrible.
Okay.
And vice versa. If you're someone like me who has lots of antsy energy.
I can see you bouncing.
Yeah. Sometimes you need to do those things to get that energy out. So I would say there's no magic number, but that 30 minutes a day or more is what we're looking for. And whatever you can get in there makes you feel good.
We've covered walking. We've covered running. Personally speaking, what do you prefer, running or walking? What do you suggest, running or walking?
I actually prefer both. And like Neil had mentioned, it varies person to person. So growing up and in my youth, I was very active with running. I ran through high school and my collegiate career. Nowadays, I'm not as competitive as a runner as I'd like to be.
But you have children and you run around after them.
That's true. That's where I get my workout. Okay. Having twins and pushing them in a stroller while we go for our walks at night.
That is a walk.
It is a workout.
Yes.
But I tend to like both. Lately, I've been favoring walking and then just like short duration sprints after children that are beelining it in different directions.
They have something in their mouths and you know it. You better run after them. I understand that. Neil.
I'm kind of a both also. I would say traditionally I prefer running way more. I cover more distance, see more things, just go faster. I used to love the PRs.
What's a PR?
Personal record.
Oh, yeah. I got to beat my personal record. I do that on 22.
Yeah. But so, I've dealt with injuries more recently, and so I do a lot of walk running, and I've actually found that I'm as fast, if not faster, walk running. So I've really learning myself that there's a place for walking that's beneficial, and I love walking my dog on a nice day or going outside walking with my wife. So,
that's nice. Now, what is walk running? Is that like power walking?
You walk, then you run. You walk, and then you run. You walk, and then you run.
You can't make up your mind.
Interval.
Yeah. A little bit of running, a little bit of walking, a little bit of running, a little bit of walking.
Yeah. So right now, I walk 4 minutes and I run 6 minutes, and I do that for about an hour, and that's my workout.
Does your wife do that with you?
No. She lets me do the running.
She's a smart woman. Ashley and Neil, this has been so educational. It's been so much fun. Thank you so much for joining us today. I hope you had a good time as well.
Yeah, this is great.
I enjoyed
this. This was a lot of fun.
Yay! Maybe next time they can let us have drinks while we do this.
Ooh, all right.
Don't necessarily think that we should do that.
Or we can go for a walk.
Oh, we can go for a walk or a walk, 2 drinks.
Ooh, there we go.
See, combining the best of both worlds.
Pub crawls are a big thing with running.
Look at that. Yeah. See, we're problem solvers. Ashley, Neil, thank you so much for taking time out of your day, for sharing so many really great, insightful things. And I hope it was enjoyable.
I had fun.
It is a lot of fun.
Yay! Maybe we should do it again sometime.
Definitely.
That'd be nice.
Yeah.
I think that's great. Again, thank you so much for sharing your time with us. And please check out community marathons and runs in your area by visiting lvhn.org/running. You can also learn about rehabilitation services offered on lvhn.org/rehab. Remember to subscribe or follow the Healthiest You wherever you get your podcasts so you never miss an episode. And remember, be safe, be smart, and be the healthiest you.